Great, thank you very much. It's great to see everyone. So I know you're at the end of the day, and you've been involved, actually the last 2 days, in a lot of really intense subjects. I was listening in on a few today, and some really incredible stuff going on. So I'm going to take you, my job over the next 35 or so minutes, is to actually take you way out of your day-to-day, all right? And think about some of the big strategic imperatives and challenges out there. And then I promise that we'll bring it back down into healthcare as well, all right? So where I'm going to start is absolutely looking at, actually not related to healthcare, but as I said, big global challenges. But the reality is anything I talk about at the global level is absolutely, completely important for us on the day-to-day because we're needing to think about what the future looks like. Then, as I say, I will start talking a little bit more about healthcare. So just stick with me as I do it. So I'm going to take us through a framework called ADAPT. It's something that we use, for example, with the NHS Leadership Program on NIBEVN to really help leaders think, again, broadly. And basically what ADAPT is it's about looking at a range of interdependent challenges that are facing, as I said, the world right now. And we're going to go through and look at a few of those and understand a bit more of them. And basically, if you think about asymmetry, disruption, age, polarization, and trust, they're all topics that, quite frankly, you turn on the news, you look in media, at the dinner table, we're talking about them all the time. But what we found is that the reality is, when you come back into organizations in the workplace, we don't actually talk about them in the way that we should, because we are so busy dealing with the day-to-day and not having that time to stand back and think about how some of these major issues are actually impacting our organizations, our sustainability, and the future that we're looking for. So let's start going through each of these first. I'm going to start with asymmetry. There are so many different angles around asymmetry that we could talk about. The one I'm going to choose to talk about is absolutely asymmetry in wealth and the erosion of the middle class, because I actually think this is super important to all of you. The big headline always that people get really fixated around is the fact that 55% of the global population, 55% of the global population only holds about 2% of the wealth. 1% of the global population has about 47% of the wealth. And people get really fixated, and we talk about the top 10, and Elon Musk's name comes up, and all of that kind of thing. Well, this is interesting. The thing that's the most interesting for me, from a business perspective, is actually the erosion of the middle class. What we've been seeing pre-COVID, and then accelerated by COVID, is actually the middle class, which drives the economy, is declining, right? Because the middle class, as I say, drives the economy because we've got the discretionary spend. We love takeaway coffees. We go out to dinner. We do all kinds of things that really make the economy go. Now, what we saw during COVID was this erosion not only continued, but actually increased, right? So people that were just hanging on at that level of middle class have now dropped out. And now what we've got, of course, is this recessionary environment, high inflation, and we're seeing even more erosion of the middle class. We're seeing potential unemployment rates that have gone from, the lowest in history to potentially up to 6%. So all of this has a real impact when we look at, as you say, sort of asymmetry in wealth. The next thing I want to talk a little bit about is disruption. Now, again, we know that literally every day there is some big new disruptive event going on. The world has changed from being kind of predictable to not at all. The two I really want to talk about in terms of disruptors is technology and then climate change. Now, all of us have been disrupted by technology, and primarily in a really good way, or at least I think. I know where my kids are, even when they're at Reading Festival or something like that, right? So it's good. It gives me comfort. However, what this graph is showing us is that there are some downsides as well to technology. So for example, we've had a lot of increase in efficiency through the use of technology, but we haven't seen that play back into wages. So efficiencies that organizations are gaining because of the use of technology isn't translating directly into workers. The other thing that we're seeing is that a lot of the jobs that are being replaced by technology are some of those lower skilled, quote unquote, jobs. So for example, when we go to the grocery store and we're checking out ourselves, we've just replaced someone's job, and technology's helped us do that. And that, again, impacts the erosion of the middle class even more. So there's some downsides to technology. There's some upsides to technology as well. And again, we saw through the pandemic that the use of technology absolutely fundamentally changed the way we work. If you think about my own organization, we had Google 2 years before the pandemic. And quite frankly, we were still kind of calling people. We weren't video conferencing at all. Even when we were dealing with global colleagues, we'd rather get on a plane than turn on our laptop and turn on the screen. Within 24 hours of the pandemic, 20,000 people in the UK became avid users of the video conferencing facility on Google. Within a week, we'd moved to most of our interactions with our clients to being through this mechanism. And 6 months later, I was in a global meeting as an avatar, standing there with my global colleagues, having conversations because I had my virtual reality headset on, right? Fundamentally changed the way that we use technology in the workplace with the pandemic. I also saw a really interesting article in Sage, which talked about palliative care and the use of technology. Pre-pandemic, something about 23-24% of services were using sort of the use of teleconferencing and so on and so forth. During the pandemic, that went up to 84%, and not just in terms of relating with patients and families, but also with other specialists and healthcare providers. Again, a fundamental change in the way in which we're using technology at work. That's all really good, but there's a really interesting asymmetry point to bring up here, which is around the potential for what we call basically digital asymmetry or digital poverty. Because we still have in the UK 6% of people that cannot access the internet, 12% that don't have smartphones. So when we think about how we use technology going forward, we need to think about the entire population and how we access that population. Now, the other disruption I wanted to talk a little bit about, this is a cheery one, is climate change. We will have all seen just recently from COP27 that we're really not going to be to a place where we can hold down the 1.5 degrees in the next 7 years, which I think was seen as very key. We're seeing disruption from droughts to flooding. We're seeing all kinds of things happening. This graph is actually just showing a little bit more about water stress by 2030 and where it's increasing and growing. And again, very, very cheery slide. The really interesting thing beyond sort of the individual impact and the planet impact of climate change is absolutely the impact on business. They're saying that some estimates that in the US, but by 2050 roughly, $14 trillion will be lost in business disruption because of climate change and the impact on the supply chains, et cetera, et cetera. Okay, that's a lot. That's even more than Elon Musk has, right? 14 trillion. At the same time, when you think about climate change and the fact that there's this huge business disruption, we did a CEO survey, and only 33% of CEOs are even considering climate risk when they look at their businesses and the strategies and mitigation tactics that they need to have in place. Question for you all: are you looking at it? Now, there is also a nice interaction between both technology and climate change. On the one hand, the internet actually seems to have the same carbon footprint as roughly the airlines industry. Interesting. But also, technology is having great innovation in terms of being able to help us predict the impacts of climate change and help us to actually mitigate against some of those risks. So again, lots of other disruptions out there, but I think two that are important for us. The next one is age. And when we think about age, there's two different ways that I want us to look at it. One is, we've got countries around the world that actually their population is moving towards having greater percentage kind of moving towards retirement. But we also have a lot of countries where actually the biggest thing happening from an age perspective is their populations are moving into work. So a greater majority that are moving towards the workforce as opposed to out of the workforce. So we're going to start for those that have a higher age and that's sort of the demographic that's moving to more being at that retirement and beyond age. So if we think of Japan, average life expectancy 85, UK, I think it's about 81, falls in this kind of category that has this impact, which is basically saying that for the number of people that are outside of work because of, let's say, 65 plus, actually there's a huge pressure on the people that are in work to be able to support because that population is getting so big. So here it's, saying, by 2050, 25, for every 100 people in work, there's 25 that are retired and beyond. So major implications, right? One of those implications, as I say, is just the stress on the healthcare system, on pensions, welfare, et cetera, but also if you think of palliative care. I've seen estimates that are saying that palliative care needs are going to increase by 25% by the next 5-10 years, right? So again, huge implications. Also, interesting, I'm not going to say benefits, but interesting other angles. We're seeing that people actually aren't stopping working at 65. And they're working longer, they're having to learn new skills, so there's something around what does the workforce of the future look like. Now, we did see, post-pandemic, a lot of people, kind of 50 plus, saying, I've had enough. I'm retiring. I'm out of the workforce. Now we're seeing in the UK a really great trend, which is called the unretired. So there's people that left the workforce, they're saying, actually, I really like engaging with people. And by the way, cost of living crisis. I'm coming back into the workforce. So we're seeing a lot of organizations now saying, that's an interesting opportunity. How do we actually attract the unretired to support us and our workforce challenges? So whether that's things like increasing volunteering, whether that's things like actually people with skills that are relevant coming back in, training, using those skills. So again, another one to really think about, is there an opportunity for a wider workforce pool than you're tapping into today? If we think about the other side of the spectrum, which is the countries where the move is more towards more people coming into working age than not. So again, like if you think of a country like Chad, average life expectancy is 54, pretty young population. Their issues are very different because as they get more people moving towards a working age, the problems they've got is how do we have an education system that can take this big boom of people, make them fit for what's required in the workforce world, and how do we create enough jobs and enough businesses to create the employment required. The graph you see behind me shows some of that variability in youth unemployment. You see in North America, it's something like 9%. You see in Northern Africa, it's closer to 30%. So for some countries, it's how do we create jobs? Again, we see an interesting intersect with technology. For example, in Africa, we're seeing more and more companies leveraging the talent pool that's there, using technology to help deal with workforce challenges outside of their country. So example would be US tech companies. And what's really interesting here is they're paying competitive salaries to what you would find in, for example, in this case, the US. This is a game changer in terms of creating jobs. So again, how do we leverage where there is more workforce available to us? Polarization. This one we definitely see in the news in many, 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 many different ways, pretty much every day. We've gone from really kind of wanting to be sort of together and global and, really thinking about alliances to moving much more towards fragmentation, more nationalism, more populism. And that's certainly having some different impacts that we're seeing played out. The other side of it is, it's also creating some stronger voice from communities that are saying, actually, we're coming together and we've got to counteract what we're seeing around us. really good examples. Again, you think about George Floyd, Black Lives Matter. That is the whole kind of population coming together and saying, hey, enough is enough. We've got to stand up here. You think in the US, the vote that we've just seen happening, the youth vote was so important because they're saying, we're sick of shootings in our schools. We don't like the way the country's going, so we're activating now. And we know it's important to vote, which was something that was less important in the past. So again, there's some positives to this as well. And the last one is trust, and the T looks like it's dropped to the side, but it is trust. Yes. So this is just a graph. I mean, exactly, right? I was thinking the same thing that I think many others are. There's a T in that one. There's definitely a T in that one. This is just something from the Edelman Trust Survey. Really interesting read. I would just say download it, bunch of slides, really, really great. They survey about 36,000 people a year globally, and it's all around different aspects of trust. Some of the things that were coming out of this year's survey was, and again, not shocking, were things like governments and media are divisive. We don't trust them. Businesses and NGOs are unifying. We're more likely to trust our CEO than we are the leader of the government. Now that makes some pretty heavy, I'm seeing there's a few CEOs there that are saying, yeah, that's me. That puts some pretty heavy pressure on, because there's also, and I am looking right at you now, there's some real expectation now that says that businesses have to play a role in solving some of society's biggest problems. They can't stand back and be passive. There's expectation there. The other expectation is that business leaders are actively engaged in policy influencing. Again, important for all of you, engaging in the debate. The other thing that I thought was quite funny that came out of this survey, and again, not surprising, people didn't trust the news too much. They thought there was a lot of fake news, which I thought, okay, yeah, no surprise. We've heard that term a lot. But also very interesting in the trust survey was another asymmetry. There is a difference in trust dependent on income. High earners tended to trust more. Lower earners tended to trust less. In the UK, the differential between that trust level is 25%. So again, different populations thinking things very, very differently. So that's just a quick canter through what I call sort of the adapt, the big global stuff. I am going to bring it down a little bit, here. But I do think there's a few things to really think about, and particularly around things like technology, right? Because we are going to talk about it a little bit more. But there's a real onus on us as leaders to really understand technology. Because some of the decisions that we're making right now for our organizations and the communities and the people that we serve, if we don't understand technology, we're probably not making decisions that are fit for the future. And so a big question for everyone here is, are you tech savvy enough? All right? So now, I'm going to bring it down a level. So all this stuff going on, big global challenges. What does that really mean for us? Well, part of it means, as leaders, that every day we're in a continuous cycle around repairing, rethinking, reconfiguring, because we have to deal with the challenges of today, got to figure out what tomorrow looks like, and then we got to make the changes to make that happen. And that's tough going, right? It's really tough going. We're going to look into a little bit more of each of those. All right, so repair, again, it's really, really thinking about today and what do we need to do to be viable. If I was standing here 3, 4, maybe even 5 years ago, and I started talking about the challenges that were impacting the NHS and healthcare, and some of them are up there on this slide, and there's many, many more, they're pretty much the same as the challenges that I'm talking about today. The issues that we're dealing with in repair are the same big, wicked problems that we've had for a long time. But actually, a number of them are accelerating and becoming even more difficult. Again, we talked about the workforce challenge, you know, and we all know the situation we've got right now. We have insufficient number of people with the skills and capabilities required to deliver the care that's needed across healthcare. We've got a tired workforce that's been through a lot. We have things around pay rounds that are basically saying that we're not really quite sure how much increase there's going to be when you take in inflation. And I think the King's Fund put out a report not so long ago that said that actually 30% of healthcare workers would have a 6% increase if they went and worked at the best paid supermarkets. Right? So, like, there's some issues here. We've got a budget that thankfully, Jeremy Hunt's budget wasn't quite as cost-cutting as there were some predictions back in October of needing to make some major cost cuttings. But again, with inflation, we don't really know what the real term impact is. So again, a lot going on here in the repair space. And in fact, I would say, having gone to some of the sessions today, but also seeing the sessions that were happening yesterday and today, a lot of what you're focusing on is repair, right? The issues around repair, and every day, how do we fix repair? So I'm not going to try and summarize all the great topics that you've already discussed over the last couple of days and the things that you're grappling with. But what I would say is that there's 3 imperatives adding to all the others that you will have gotten that I really think it's important to think about when you're thinking about repair. The first one is a basic sustainability of your organization question. If you have not already thought through the scenarios of a recessionary environment on your organization, and that might last 1 year, might last 2 years, like that's something to do tomorrow, right? And the types of questions that you really want to be making sure that you're looking at is, what kind of risk is your current funding streams? I talked about the erosion of middle class. It's no surprise Hotel Chocolate, Fever Tree, shares are declining. People aren't spending there. Made.com, gone into administration. Staples of the middle class, right? And I saw this morning in a presentation a whole bunch about funding and the level of funding sort of declining. People are tightening their belts. So there's a big bit of what is the demographic of your funders? And what is the implication of some of the things that I've been talking about? Flip side is, where are the other revenue streams that you can leverage harder? Again, we're seeing in the news all the time. Charity shop shopping increasing. How do you further leverage that? Etc. Thinking about, are you as efficient as you can be? Are you agile? Can you handle disruption? And what do you need to do to make that a little bit more palatable if there is some sort of disruption? And also under that first one, you know, I'd be taking a really good look at, are there opportunities to work with others to help on that sort of the cost side of things? Where can you scale across multiple organizations and some of your back office functions, et cetera, et cetera? So again, I'd be really looking pretty hard at scenarios around implications of a recession. The next thing, which is more of a positive one, try and get that one in there, is I would also really look at the workforce. I mean, I go back to, come on in, unretired. What can you do with them? You know, how else can you use some of the potential 6% unemployment, you know, et cetera? How can you use some of that and think about what is your strategy to attract talent in an environment where there might be more unemployment, there might be more people coming back to work? Actively, what might you do there? And the third imperative when I think about repair is all about thinking about the fact that repair is so all-consuming that it's dangerous. Because you can't just repair. You have to have time to rethink, and you have to have time to actually reconfigure, which we're going to come on to in a minute. And so creating that time and space to do more than just repair is super important. So let's go on to rethink. And again, rethink is literally just getting that time and space to make sure that the things that you're doing today are in the context of where the future might go, so that some of those decisions are building the platform for the future that you need to be sustainable and particularly relevant. And I think one of the interesting things for me is often when we think about rethink, we've got these people with these great titles like futurists, and they often are in places where you've got beanbag chairs and really wonderful snacks and like the thinking future, and those are the innovators. There are people like that, and they definitely are innovators. But the kind of innovation I'm talking about is actually the stuff that we all can do, because really, if you have the time and the space to think and the stimulus to do so, you can innovate. And there's different kinds of innovations. If you think a little bit more about kind of incremental or radical innovation. So incremental innovation is basically what we did all through the pandemic. We took what we had, we lowered the resistance to change, and we pushed some change forward. So again, teleconferencing, great example. The more radical innovation, again, isn't coming up with things that no one's ever thought of before, but it's actually, again, about rethinking. A really good example, I was listening to a conversation with someone from NHS England, and they were having a bigger conversation, and it's about models of care and so on, and somehow the conversation got into sort of the blood pressure cuffs. And he's like, and how do we use this better? And he's like, I just said, like, why are we even discussing this? App capability means the blood pressure cuff and making it better isn't actually relevant for tomorrow. We need to be talking about things that are relevant tomorrow. That's a really great example of what radical change that isn't that big a deal. It's just rethinking about things and making them different for the future. Very quickly, I'll just say that there's a lot of great enablers right now that are out there that I think this is a great time, if you can get the time to rethink, to do it. So if I think about, again, the imperatives around rethink that I'd like you to consider, outside of just getting the time and the space, the complexity of what's going on in healthcare today and in the future means that actually we can't rethink on our own. So it's fundamental that you retain the place at the table that you have so rightfully got during all of the pandemic, et cetera, in the systems in which you work. Because you are absolutely crucial to defining the future of palliative care and the way forward here, and being part of the rethinking that's going on. Now, I've been talking to some of your stakeholders, and it is crystal clear to me that they value so much about you, and that you should come to the table with confidence, okay? In particular, because you are the specialists. You do understand palliative and end-of-life care. You understand the quality, you understand what's required, and you, most importantly, you understand patients' and families' requirements, and you go beyond the pathway of just delivering. You also have all this wraparound support. And when I talk to stakeholders in different systems, they all say this is so valuable. In particular, that data and understanding about requirements and needs when we're rethinking and going forward. But they've also said to me, they would love it if you would have a bit more time. I know this is like time is like, yeah, sure. But if you had a bit more time to think about some of the bigger strategic things going on in the systems where you're working, and then align that a little bit more, not only to the strong operational capability you have, but the strategic insights that you can bring to the table, okay? So it's kind of lifting up there, taking all that great knowledge you have, and actually bringing it back as clear insights. So some of that then goes back to really making sure that you're using things like the data you have, the insights you have, to ensure that you are using your voice at both local, regional, and national levels. I thought that the Marie Curie presentation in this room this morning, made a really great point. Yeah, we're having conversations nationally. Join those conversations, but please, please, please have your conversations locally. I agree. You really need to think about what are the key issues, where your voice is super, super important, and have that confidence that I was talking about earlier. The third thing around rethink that I really want you to just kind of have in your mind is, again, the challenges that we have actually take a much broader ecosystem of organizations and so on to solve. So a good example is, if I think about some stuff going on in the stroke pathway, I know there's a startup company, it's a tech company called Visionable, who's working with Verizon, which is kind of a BT equivalent in the US, but they're working here. They're working with the NHS at national and local levels, and they're working with stroke charities, combining together to redefine the pathway. And so it's, again, thinking very broadly about what are the ecosystems that you need to be part of to solve the biggest problems that you have, because people are very intentionally making those kind of, partnerships and so on. I'm just curious, just raise of hands, how many people are in those kind of wider ecosystems that might have, private, public sector, et cetera? Just a quick hands up, just so I get a feel. Yeah, so it'd be interesting. Another point, just to hear a little bit more how that's going. But I think it's super important to think about. And the other thing that's important to think about is not just simply what's the range of capabilities you need to solve those problems, but also what is the role you're going to play. Are you the convener? Are you the innovator? Are you the insight bringer, right? So really thinking about that's going to be important going forward. So then if we move from rethink to reconfigure. So you've done all this great thinking, and reconfigure is really around dramatically redesigning, in this case, the way that care is delivered. I'll come back to that in a minute. And again, I think all of us would say that models of care are being reconfigured all the time right now. And in fact, we're moving from a place where a lot of healthcare was delivered very much in the hospital context, and that's changing, and it's very physically delivered in one place, and that's changing quite a lot. Now, before I go any further to talk about this, I did just want to make sure, you can see it, I can't see it so well there, I did want to make sure that you just have a minute, because I've used some of these already, and I might use some of them as I go forward, just to give you a minute to just take a look up there, and if I said AI or VR, you're not like, oh, what is she talking about? I'm really not going to talk too much about the metaverse. I just find it so funny because you're seeing ads all the time around the metaverse sponsored by Meta. And actually, I realized the metaverse is basically Fortnite, where my kids spend way too much time. And I was like, that's it? That's it. But anyway, it's more than that. But we'll go from there. All right, so that just gives you that. When we think about reconfigure, technology plays a huge part. I mean, we talked about it being a disruptor. We know there's tons of stuff out there, all kinds of different bits of technology that are combining together, they're converging, and by combining together, they're allowing us to do some really different things. And again, I'm going to run through each of these, and I'm sure that you also are all aware of all of them, but I just thought a quick canter through. Virtual wards, hospitals at home, I know is getting a lot, and hospital at homes is kind of being pushed into virtual wards. There's a lot of funding across the UK looking at virtual wards. I know palliative care isn't one of the areas right now, but actually, I think it's going to be something really important, and it will be coming to palliative care, and you really need to be engaged in understanding about virtual wards. How many people already are kind of like, yeah, virtual wards, I'm all at it? Good. So a lot of people, because I think this is very important. And I also know that NHS England is doing a little bit of some work on remote monitoring, for example, with hospices right now. Is there anyone in the room that's involved with that? Okay. Can't quite tell if there's a hand up or people just, I would say it's super important to be engaged in understanding anyone who is involved in some of this kind of early pilot work around remote monitoring, et cetera, for hospices, because A, it gives you insight into where the thinking is of what's possible. B, it gives you a chance to actually get your voice heard in that. When we think about kind of stepping a little bit beyond virtual wards, I think there's a couple other things that become really interesting when you think about how we could be augmenting care at home. The use of medical drones. Drop off medicine. Take samples to labs. I mean, that's, it's happening. The other one, of course, is virtual reality visits. Not just me going in on virtual reality with my colleagues, but a nurse visiting someone in their home, and maybe the family involved that's sitting, in my case, in the US, all with headsets, meeting in a virtual room to talk about real-time data from remote monitoring, wearables, etc. That's, it's not sort of science fiction anymore. The next one I want to talk about is digitized hospitals. Range of different things here. I don't know how many people, kind of smart hospitals, connected hospitals. We're seeing them, they're running in the US, they're running in Australia, Finland, range of different places. In the UK, we've got some hospitals that are moving that way, and that's all around using a lot of different data to help actually change your understanding of how patients flow through the hospital, things like when beds are free, where you've got your supplies, and just doing a lot around connecting data to make hospitals more efficient and care, hopefully, better. The other one, I think, just not quite the same as smarter connected hospitals, but a really interesting trend is around the use of, again, VR, virtual reality. Anybody using virtual reality right now? Okay, good, we've got a few. So you'll know these examples even better than me. But I'm really intrigued because you've got, in the UK, we are seeing hospitals that are using virtual reality actually to supplement conventional sort of anesthetic and so on during surgery. We've got Birmingham Children's Hospital using virtual reality to help kids reduce anxiety before surgery or keep them calm when there's a difficult procedure going on. And again, because we've got some examples here, I wish I knew them because I would use them right now, but I'll use an example from the US. Hospice in Michigan that's using virtual reality to give people within the hospice the chance to go to special places, do things that they can no longer do, scuba diving, swimming with sharks, I don't know, whatever it is, right? So again, it starts being really interesting around how that might enhance what a good death looks like, giving you the chance to be in the room with someone that you love that's on the other side of the world, doing something you loved, right? So again, really interesting, and again, I'd love to hear at another time, those that are using virtual reality, what you're doing with it. Predictive analytics and population health management, again, a lot going on in this space. You guys have a lot of data. If you collected that together, you have so much understanding through the data that you have that you could be driving so many things around predictive analytics and population health management. But a lot of things, AI, clearly helping us to look at data sets and do different things with them. The whole concept of a digital twin, where you use data, real-world data, to basically make a copy of something, a process, an object, a system, potentially a person, try things out on the digital twin, and then bring those into the real-life situation. Very interesting. And population health management, where you're using data to really look at a population and what are the interventions that work best. Last two I'm going to just get through very quickly. One is just freeing up more time to care. Repetitive tasks being taken over with machine learning, AI, care records, making it easier to connect, etc. And then the final one is around education and behavioral change. Really interesting. There's an insurer in Japan who's now just made insurance for dementia. And they've used a bunch of information and AI to then identify things that if people do certain behavioral nudges, they can have this insurance because it will actually, they think, delay the onset of dementia. So they're willing to give them this insurance. So again, really interesting what's happening there. So I think, main thing here is a lot going on in technology. I go back to important to be technically savvy. The list of imperatives that I have here around reconfigure aren't actually mine. Again, when talking to some people in the digital team in NHS England, and I said I was going to be here, and they said, this would be really important. These are the areas that, if the hospices helped us lean into this, that actually this is kind of going to really help us drive reconfiguration, particularly using technology. So I thought, well, I'm going to share it because that's what they've asked. So I'm going to stop right there because I said a lot. The main thing I guess I want you to go away with here is, I know you've got a huge amount on your plate every single day. And again, speaking to your stakeholders, I know how much you're valued, and the work that you do is incredible. But we're doing it in the context of a world that has so much going on, and we have to make sure that not only are we focusing on repairing, but we are taking the time to rethink about what the future looks like, and actively engaging. Whether you are big or small, you have to be engaged in the conversations around how end-of-life care is going to be reconfigured for the future, because you guys know it better than anyone else. I'm going to just stop there.
Kalee, thank you so much. I know that would have given people an enormous food for thought. And actually, for me, I think helpfully starts to sort of piece some of these really big global system challenges together in a way that starts to make a bit more sense. So thank you for guiding us through that. And I think that powerful message around the importance of the people in this room, the leaders in the sector, to be active and confident in their engagement in the future for palliative and end-of-life care. So that's a really important take-home message for us all. I am going to. We are a little bit over, but I think that's good. No apology needed. Because I do want to have a bit of time just to add in a couple of the questions that have come through from the floor and from those watching online. The first, I think, really picking up on that point around technology in its broadest sense, digital health provision. A question from our chair, Paul Jennings, who asks, how do we make sure that this doesn't become the worst example yet of the inverse care law?
Well, that's a big question. And I guess the first thing that I probably should have said early on, for me, everything that we're talking about in terms of technology is only in the context of human-centered care, and particularly when we talk about the care that you give, right? And so I think the big thing that we always have to think about here is the starting point is that human-centered element, and that the technology is only about enabling. So I don't know. Someone else might have a better answer out there. I'd love to hear it, but that would be where I would go.
Thank you. That's great. And I'm going to come to a question from Debbie Talbot, who makes the point that obviously clinical workforce pressures create a tendency to pull everyone into operational delivery, particularly when things are under pressure as they are now, and particularly in small teams. What advice would you give hospices on how we can make sure that their experience, their expertise, and the cost of that expertise, that clinicians get the time and space to engage in some of this strategic visioning?
Yeah. So, and again, I get time is the one thing that we don't really have enough of, but the reality is that we have to prioritize strategic thinking alongside everything else. And so for me, when I was talking to organizations around how you make this time to have, be more on strategy, is you genuinely have to carve out the time, and you genuinely have to plan for it. And the other thing for me, particularly with clinicians, I think it's helping them understand and making sure that they're clear on the value that time doing the strategic thinking will give, so that they don't feel like they're losing time to care.
Thank you. And the final question, which I think picks up on some of, which I can see a thread from this, from Jackie Goss, who says that she's not sure whether there is a breakdown in that global consensus that you talk about. Maybe it's that there was always a lack of consensus, but now it's easier for groups with divergent thinking to reach each other through tech and through various other channels. And her question is this something that we should embrace rather than fight against and fear? And is that, I guess, by extension, is that part of the toolkit to have this sort of transformational conversation?
Yeah, so I actually think, and again, if you think about social media, what's super important is that we don't live in an echo chamber. And I think this whole bit around having more access to a wide range of views, we do absolutely have through technology, through social media, through all kinds of things, and we do need to lean into it. And I think one of the biggest problems we have is that people tend to read, talk to, and interact with those that have the same viewpoints. So I would absolutely be saying, yeah, definitely use technology and the different sort of wider access that we have to go find the counterfactual, go engage with the views that are so different from our own, and figure out what we can learn from it.
Well, I certainly feel like conference so far hasn't felt like an echo chamber. So that's a very good point to, I think, end this session on. Kalee, thank you so much for taking us on that journey and for giving us a lot to go away from the end of day 2 of the conference to think about. So if we can thank Kalee in the usual way. So that brings us to the end of day 2 of the conference. I hope you all have a wonderful evening and lots of space and time to think about some of these big questions and big challenges, and we'll see you back in the morning for the final day.